morning, everybody. Thank you for attending. So today, or this morning, we'll be doing the Allied Health Professionals EBA Forum. So I'll introduce myself, Emma Scott, Senior Workplace Relations Consultant, and then with me today is...
James Farrugia, Workplace Relations Advisor.
Yep, so some of you may have spoken to James, who's been here for about, I think, 6 months now, so he's happy he's passed his probationary.
Oh, just. She can't use that card anymore.
Dang, no. So in terms of the agenda today, we've split it up into part 1, which is EBA progress report, because obviously it's with the Commission. Part 2 is the implementation, and part 3 further questions. So with questions, there are people streaming online, so they're just to email communityhealth@vhia.com.au, and James will just be looking at those questions, and as they come in, he will answer. And then just for the purposes of the microphone, when people do ask questions in here, James will try and repeat the question so it can be heard to people online, and then we will obviously try and attempt to answer those questions. Anything that we need to follow up on, we'll do a post on the guide or put it in the implementation information that we're doing. So in terms of part 1, the EBA progress update, we lodged the agreement with the Commission on the 6th of February following a successful vote of staff. And two weeks ago, we received an email from the Fair Work Commission about some issues, which we see as quite minor. There wasn't a long list. Number 1 we've got on the slide is minimum wages. So that's in regards to medical imaging interns. Now, the reason for those, which we're not sure if anyone actually has, is just because the wage rates are so low, and based on the type of qualification they have, they're meant to increment at a higher point under the Modern Award, so therefore they fall below minimum wages. And then with the assistant allied health managers and the allied health managers, if they were to translate to a level 4 pay point 4 under the Modern Award, again, they fall below the minimum wage. So what we've talked to the Commission about, or provided them with a response, is to say that ideally what we want to do is make the minimum rate the July minimum rate in the EBA, and then adjust it according to the relevant increases. So therefore you don't have to keep referring back to the award, you can just refer to the agreement itself. So we put that to them. The second point is the individual flexibility arrangements. So they raised 2 issues. One is about, it doesn't actually say you have to give the person the IFA within 14 days, which is a requirement. We say you've got to give a copy to them, but it doesn't have the time frame. And then the next one is, and I think VHIA disagrees and is going to try and argue, it specifically says 4 weeks notice, whereas the Fair Work Act says not more than 28 days notice when you want to terminate the IFA. So I'd like to leave it and just get it approved as quick as possible, but VHIA may not. But either way, with the IFA, there's not an undertaking required. They just attach their standard IFA clause as a part of the agreement, so there's nothing that needs to be done. With the third one, it is in regards to shift work allowances. So they've done some modelling, which we've requested from them, that says that for some reason they're under, because the allowances apply in a different manner. Under our agreements, the allowance is like a flat rate for the particular shifts, whereas under the Health Professionals and Support Services Award, which is the Modern Award, it is a 15% loading on each hour worked. So because they're applied in a different manner, they're saying some people may not receive the same amount. So what we've done is ask them for modelling information, because we don't want to address something that isn't a problem. We'll address specific classifications, but not where there aren't any problems, and their feedback was quite broad. So that's why we've asked for the modelling, and then we'll hopefully work with members that do have that kind of shift penalties to see, can we get out of an undertaking, or if we do have to do an undertaking, what that might look like. And trying to go for ease is really what I like to do with the undertaking. So we will work that out. But really, that's a small number. So we did respond to them prior to the Easter break, and we haven't got a response yet. And then the only other additional thing is when we've looked at it, there are some minor cross-referencing that we're also going to try and get fixed, just some errors there with referencing wrong clauses, so we're also going to try to get that fixed. So hopefully, depending on, I'd say maybe a month or a month and a half, probably, I would have thought, depending on the Commission's timeframes and how long it does take us to get undertakings and signed undertakings, if they require them. Again, inconsistent process. We had to do undertakings that were signed by employers for the SACS agreement. Health and Allied, no. Health professionals, not quite sure. So it just depends on who you get. So that's the status update on where everything is at in regards to the approval. So part 2, implementation. So just going through the clauses, clause by clause, some of them may require some of them discussions, some of them will be quite simple. So clause 6 is the date and period of operation. So it will come into effect 7 days after the approval, which obviously we don't know yet. And then it will expire on the 30th of June 2021. But similar to the current agreement, it does talk about endeavouring to start negotiations 3 months prior to the expiry date, which hasn't really occurred in the past but may occur next time, but we've just kept that as a rollover provision. Then we've got the consultation clause. So we've adjusted that for a new process, and some of these I've just split up into when, do what, and some exclusions. So there's a new process that you've got to do when you are engaging contractors or employees of contractors to perform work currently done by employees. And what you have to do is consult with affected employees and the union, having regard to job security of existing employees and the terms and conditions of employment of employees. But there is a particular exclusion that you don't have to do that where you've got contractors that are just doing ad hoc or temporary work. So really that clause came from, they wanted us to put in something saying, well, you can only employ contractors if you do it in accordance with the enterprise agreement, which isn't aligned with what a contractor is, but there is a process of consultation. Now we have moved the definition of consult or consultation up to the start, which really is that process is about just giving them a genuine opportunity to influence the decision, but they're not the decision maker. So it's not extended like the actual consultation process, but you do have to put those steps in place where you are engaging in good discussions and having a listen to any concerns raised. So that's a new part that we put under the consultation process. So the next one is redundancy, and this is when you may be making an employee on parental leave redundant. So after you've done consultation and it's found that the employee is going to be made redundant, you need to inform the employee that their role is redundant, that part is standard. The next part is not quite standard, which is about telling them that they can defer an attempt to redeploy until they've returned from their parental leave. So at that point, the employee will either make a choice to defer the redeployment, in which then you wait until they finish their parental leave, or the next one is that they elect to redeploy and they accept redeployment. Then they're redeployed into that role, but they're not required to reduce their parental leave, which might mean that then you would replace the position with someone on a fixed term until that person from parental leave comes back, and then they are redeployed in that position. So really that process is about ensuring that employees can, on parental leave, partake in the redeployment process, because obviously earlier on it's going to be less likely that they're going to be able to redeploy and be able to do that. So they are able to make that choice, but they make it, when the redundancy occurs, it's not just going to flip one and forward between each other. So that was a new process. So the next one is individual flexibility arrangements. This is just a simple one, just about an employee can appoint a representative, including the union, for IFA purposes. Again, it's just reminded that they don't have to approve it. An IFA is only needs to be signed by someone else when they're under 18 for a parent or guardian. So obviously if that person is their parent helping them out, they do have to sign it, but the union isn't required to say, well, we have to agree to an IFA. It's between you and the employee, although they may need assistance with negotiating what those terms are. Which there was no exclusion not to have it anyway, but it's just making it clear that if they need assistance, obviously they can have that assistance. So the next one is a casual conversion clause, which is a new process that applies to casual employees who have worked shifts on a regular and systematic basis over a period of 26 weeks or more. We just got in red that it excludes when those hours are worked by replacing employees on an absence long service leave, annual leave, etc. They're just examples, or a flexible work arrangement, because really that's not about free hours. Those hours belong to someone, so those hours are not able to be converted. With a request, it can be made by the employer or the employee, and it's obviously conversion to a full-time or part-time role, and it must not unreasonably be refused by either party. With the response, it's in writing within 21 days, and then you've also got to put the reason for refusal. Now, in the request that you may make to an employee to say, we want you to convert, you also have to tell them about those rules. So you need to tell them that when you make a request to say, we want you to convert, you need to respond within 21 days. Also, you need to provide us with your reason for refusal. So you do have to do that if you're the one requesting the change, and then vice versa, if they request a change from you, you need to do that response process. So with the conversion, it just clearly kind of outlines that the minimum hours are determined by the hours that are worked on a regular and systematic basis. So I guess the tip for that is really looking properly at the hours. So the hours may be a mix of replacing someone else, and then they may be a mix of hours that are actually available in the pool for someone to convert to part-time. So obviously it would really only be the free hours, I guess, that you would convert in that instance. Don't just assume that it's all about replacing people, because obviously the employee then will probably come back and say, well, no, it's not. But yeah, just having a look at that. And then obviously you have got to provide them with an amended contract of employment or letter of appointment, clarifying what their terms kind of now are. So the next one is termination of employment. So there's a new job search entitlement for the purpose of seeking other employment. When it should be taken at a convenient time to the employee, but they still need to consult with you on that time. And it's only 1 day off without loss of pay. Now that's different to redundancy. Redundancy has its own provision, which is I think 1 day off in each week. But this is termination in other instances other than redundancy. They don't apply on top of each other, they apply instead. So we made that clear in the drafting as well. The transition to retirement clause, like others, it's a bit different to the SACS, but I think similar to the HSU4 and Health and Allied. Employees over the age of 55 who have indicated they want to retire within the next 5 years can agree with the employer on a transition to retirement arrangement. It provides examples of how, which include a flexible work arrangement, an individual flexibility arrangement, or a combination of those, or just something that's agreed in writing. So really the point of that is making sure it is clear about what you are agreeing on, because if it isn't clear, then obviously there is going to be a dispute. So that's the purpose of that, provide it in writing so it's all clear about what that is. Then there's also a list of examples in there about what those arrangements may be. Reduction of working hours, job share, using annual leave or long service leave to reduce the working week. So that's about, they're 5 days, but we'll work 3 days and then you'll take long service leave or annual leave for 2 days a week ongoing. And then that's the same with reducing your hours, but maintaining that when you take your long service leave, you keep whatever your hours balance was, and then you take them at that rate. So similar process. And then there's just a reminder in there that transition to retirement arrangements, you can use purchased leave as a way to have them have some more time off from the workplace as well. So that's really about allowing people to have the flexibility to agree to those items in there. So the next one is the once-off lump sum payment, clause 23. So the amounts payable differ depending on the employee and how long they've been employed with you. So at the bottom range, which is obviously someone that's been employed for less time, prior to the 12th of July to 18, is $500. And then 2016 ranges up to then $2,500. And it is pro rata for part-time employees. So that's important to note. Now we have tried to cover off, yeah, Amy?
My question is, I have had a staff member who's just gone to point 8 and wants to know whether for the last 30 years she's worked full-time, whether she'd be entitled to the full-time rate or the part-time rate.
So just to rephrase that, the question was asked, an employee has reduced their hours from 1 EFT to 0.8 EFT and have commenced parental leave, and I'm questioning whether or not...
No parental leave.
Not parental leave, in terms of...
Reduced hours.
Reduced hours. Whether they get paid at the 0.8 rate or the 1 EFT rate.
So I was actually getting into that we tried to cover off questions that we have had because there is a significant amount of time, but there may be additional ones, that it is based on the contracted hours in the first full pay period on or after the agreement commences to operate. So we have had EBAs where that stuff is not clear and then you have to work out a guide. So in the health professionals, we did try and cover off those particular items. And the next one, which is kind of what James has referenced, is we also have clarified it applies to people on parental leave. And we've also talked about the payment for what's due on parental leave, because that's quite different where some people reduce their hours as a result of like a transfer to a safe job. So in those circumstances, if they're transferred to a safe job, then the hours are the contracted hours prior to the transfer to the safe job. So we have tried to cover some of those circumstances. There may be more. We have, we've developed, and it's for consultation at the moment, a lump sum payment guide, and that covers off things that, okay, what about people that have left? And the answer is no. But it covers off some additional questions that may be raised through the implementation. And then there's a clear statement in there saying for the avoidance of out, it does not apply to a casual, because this is really the lump sum payment, although it doesn't say it, is instead of paying people back to the last increase in April, because say they've missed out on a year increase if you count 2017. But that's that. Mm-hmm.
When's the guide going to be ready?
So we've done a draft guide and we put it up on the app, and I've also sent it to people in the reference group. So there's a draft guide, but right now I'm saying don't do any implementation with that yet, because it is subject to consultation with members and also VAPA. But yeah, so it's a draft kind of ready, and it will be similar to what we did in, it should go out the next day after it's approved. That's why we're trying to do them so it's not like 3 months down the track. There may be additional questions even once it's implemented that we might post on the app and provide answers to. But yeah, there is a current draft, and it's intended that once it's approved, we just go the next day, here's your relevant guides and that type of thing. So the next one is the 24, which is the wage increases. So this is where there are 2 periods now because of the time frame where there will be some back pay that is payable. So 12th of July 2018 is 5.25%, and then the first full pay period on or after the 1st of November 2018 is 3%. Then next year, November is 3%, and then we swapped to July, because I think that was feedback that we got to kind of try and keep it to financial years, is that then we flipped it to 2% in July 2020. So obviously as a result of that, you'll have differing back pay periods, one for July to November and then November to now. So also with the wage increases, there are uplifts, and I will explain the increments later, but we do have them highlighted on here, is that the uplifts apply to your grade 1 year 5, which is your previous grade 1 year 7, so the top of the grade 1 rate. And then the grade 2 year 4, which is the previous grade 2 year 5, so top of the grade 2 rate. and then the grade 3 year 4, which is, we didn't change any increments there, but essentially the top of the grade 3 rate. And those rates were to match the public sector rates. So they're going to be different. There's no pattern of saying it's equal to 750 because it depends on rounding as well. And then we've also done the similar thing to some of the AHP2 classifications, because some of them are similar in structure at those particular grades, but they are all marked with an asterisk in the salary circular and also in the EBA. So there's a reminder here we've got on this slide that the continuing professional development allowance is no longer payable. So the reason why it's no longer payable is that it's incorporated into the wage rates. So this doesn't mean that you don't offer something yourself, that's up to you, but there's no requirement, and you won't be getting a circular each year that says pay your people this money for professional development leave purposes. So, and it's not really intended to stop you offering something additional, but there's no obligation other than obviously the PD leave that's already in the existing agreement. Yep, Peter?
Just wondering, we're backdating to July, I think, last year. We're not backdating the professional development allowance. Has he taken it off from then?
So is the question, will the allowance be backdated to the 1st of November?
The CPD.
Essentially, the CPD, yeah.
So,
Yeah, so the wage increases from 12 July 2018.
yep.
So you get increased rates of pay. Do you deduct off?
No.
No.
So we accidentally issued a salary circular in 2018 for the CPD payment, but we retracted that because we knew that we were going to negotiate the wages incorporating the PD allowance. So people should have only paid it in 2017 and not paid it in 2018. Yeah, because we did, and then we retracted it because, yeah, you know when something, you think, you have to remind people that, oh, something's got to be sent out, and you don't do that because you think, I don't need to remind them because it doesn't have to be sent out, and then someone's efficient and they send it out. That's what happened, essentially. But yeah, so people shouldn't have paid that in November 18 because we told VHIA that, you know, it's going to be incorporated, because otherwise then the rates change and they reduce. And we actually, the reason why we covered it off is because in public sector we had an issue with it. So we agreed that it was inclusive of, and then VHIA said, well, there were no discussions that took place, and the government essentially agreed that it's to be payable, whereas we made it clear that it's not going to be payable this year. So that's why you didn't really have people. You may have had individuals knocking down your door, but there was nothing from VHIA saying you need to pay this November payment, because there was a clear understanding. I guess, you know, from a technical point of view, someone could probably claim it, but from a, you know, an in principle agreement kind of view, it's not payable. Yeah. And there's no kind of deduction because you shouldn't have paid it. So then the next one is clause 25, payment of wages. So this is similar to the SACS agreement. You make them weekly or fortnightly. That where you terminate an employee, you have to at least pay the notice on the day of termination, and that's because of their national employment standards that says you can't terminate unless you've provided notice or paid them in lieu of notice. But all other entitlements, unless you agree otherwise, are paid in the next pay period. And then when someone resigns, which is in all other instances, then you pay it in the next payday. And that's just to help people out with, you know, working out shift allowances or those type of things. Or you can also agree otherwise, like it might be that salary packaging, they need to work out those particular issues, which can take time, depending on if you've got in-house or external. But if they need longer, then you obviously can mutually agree to a different time frame. But we've tried to make that a bit easier, because the previous agreements used to say you had to get it paid on the day, all of it on the day. Superannuation, this is another one, clause 26, it is similar in structure to the Social and Community Services Agreement. One of the differences is that we did ask for full super choice, VARPA didn't agree to that, and they wouldn't agree to it in the public sector, but they did agree to extend it to industry superannuation funds, and the agreement does define what they are, which is something about being not-for-profit and having a particular amount of something, but
So not on retail super funding, you say?
I don't specifically know. I'd have to look at individual ones and what they are. No, so the question then was about self-managed. No, we did also, and I'm seeing Amy in the room was there in that conversation where we actually said, okay, try it a little bit further, self-managed, and they said no. So yeah, it's just industry superannuation funds, which you have to look at individually according to the definition in the agreement. But and I think that's because VARPA has this thing about you don't want it going for people for profit, notwithstanding the employee can and should be able to do what they want with their money. So hopefully for next time, but yeah, that was one that we couldn't extend any further, but we definitely tried our best. And then also just a clause about outlining when you do or don't pay superannuation payments similar to the SAC. So obviously unpaid leave, not paid, paid parental leave, paid leave, paid. The allowances are general, so the uniform, laundry and meal allowance, they increase in line with the wage increases that we've outlined earlier. What we've had to do with the grade 1, year 1 and grade 1, year 2 rates, because later on, I know it's a bit backwards, but I'm doing it in line with the way the EBA goes, is that previously some of the rates were a percentage of the amounts there, but obviously because we've deleted those amounts, we didn't want to increase the cost of those allowances though. So instead of being a percentage of the grade 1, year 1 rate and the percentage of the grade 1, year 2 rate, we've actually just made them flat amounts and then indexed them by the increases. So it's outlined in our circular what those amounts are, but just in case people actually have them as a percentage of a particular amount, that would need to be changed and just make sure it matches with the salary circular. But there are still other allowances that are percentage of a wage rate where we haven't removed their wage rate. So obviously they're still just increased with that relevant percentage. But they're all calculated and you should just refer to the circular for those. So clause 31 is the higher qualifications allowance. What we've included is a definition of postgraduate and doctorate qualifications, which is linked to the AQF framework. So postgraduate is something like a graduate certificate, a graduate diploma, and then a doctorate, which I think is I can't remember the exact levels, but they're, I think it's a level 8, and then a doctorate is like a level 10 or that type of thing. So we did link it to that because we do get a lot of questions about what that means. And then we also have updated a reference there to the exercise physiologist. So we did adjust the higher quals for people that commence after employment under the agreement. And it's a bit of a complicated one. It's about the entry point. So the entry point in the relevant enterprise agreement says that you have a Bachelor of Science degree as the minimum, but these people actually enter with I think like a graduate diploma, which technically, because they've got their undergrad, the graduate diploma based on the EBA is additional. Notwithstanding by the professional association, you can't actually work unless you have the graduate diploma. So what we've done is maintained existing staff, but when you have new staff come on, they won't get the higher qualifications allowance for that graduate diploma, because by the association, they have to have that graduate diploma to work in that industry. But obviously they may have a second postgraduate qualification in addition to that, which obviously it's still payable for. But that is only for new staff that commence after, because for existing staff it technically should be paid, and that's for an exercise physiologist.
Hi, am I sorry, just clear?
Yeah.
I requested a copy of the public sector reference guide. It's like a little guide for high qualification allowances, which I found really, really useful in a lot of the negotiations we've had with staff about this. I'm wondering if there's going to be one developed for community, like specific for community, because it is very acute focused, and just in the way they describe the duties of like occupational therapists and things, for example, whether or not there's something we could do for community specific organisations, because it was very useful to us.
Mm-hmm.
Yeah. So the question was whether or not a public sector reference guide or equivalent could be made for specific to the community health industry.
Yeah. So yeah, there's nothing stopping us. So what we do is we do an implementation guide, a basic one, and then the next part of the implementation phase is saying, okay, we're out of all this implementation. What's additional information that we need to issue, which is in the form of guides, and then yeah, we do additional work on that, and then consult with the employers and the union to try and get some guides. So it might be that, say for example, home visits. Home visits is quite a difficult one. We might talk to the sector, and the sector may say, home visits, we need a guide. It's not clear. We need to, make it a little bit more practical versus EBA. So yeah, that's what we actually will do as the implementation process kind of proceeds and you get down into actually implementing it. We will have a chat and develop them. So yeah, I guess that we'll do that through the reference group. So we did send out a bulletin about that. So we've already got volunteers, which is great. But we're happy to take more and have as many to help us with developing those guides. Yep. So higher duties allowance, clause 32 has also been amended. This was a last minute amendment to try and get some further changes we wanted. Really the clause now recognises the part-time nature of the workforce. So the previous agreement outlined that you had to do high duties for 5 days or more, which meant that if you did it for 4, you don't get it. But obviously a lot of people are part-time in community health, and it may be that an employee is away for 5 days, but those higher duties are shared for those 5 days by 2 employees. So really it's about recognising that someone is away for 5 days, so there still is a threshold of 5 days, but 2 employees may be doing that job and one does it for 3 days, and then the second employee only does it for 2 days. They're still entitled to the higher duties payment because in total they've done it for the 5 days because the other employee was absent on 5 days. So it's not about how long you do the duties for, it's about the other person being away for those 5 days. I mean, common example I think would be splitting it between 2. I can't see it being split between more than 3, but that's usually going to happen when you've got a team leader away or a manager or something like that. So not sure how often it happens, but it's just really updating it to make sure part-timers don't miss out. And then we've also extended it so that the higher duties clause applies across agreements, which is a little simple change. It's just changing the capitalisation to, rather than a capitalised employee, it's to a lower employee, lower E, which is really about you may have someone working who's under the Allied Health Professionals agreement that maybe takes on the manager's role, that's under the admin managers for a high duties period, and then you will have to pay it's like the minimum rate for that classification. So it does extend higher duties across agreements rather than just within the agreement. So then the meal allowance, clause 33, there's an additional allowance that's payable. When is it payable? Is that it's payable when someone does overtime for more than 4 hours. There's already entitlements to one where it's 1. If they work an additional 4, they get a further amount. And you just have to go to Appendix 3 to see what that amount is, which we've already identified earlier is indexed with the wage increases. Clause 37 is the travelling allowance. So there's additional reimbursements in a couple of the clauses. When the additional reimbursements are paid is any road tolls reasonably incurred and the cost of parking. So reasonably incurred will kind of depend on the situation, but you might have possibly a policy in place that says, well, you're not to use road tolls, but then maybe it's that there's an accident and to get to the clients. in that time, then they had to use road tolls, then it may be seen as, well, it's reasonable that they had to take that tollway to get to the client in time. So they're types of things that you would look at. And then the cost of parking. And this is all still, it's all under the couch of you travelling for work purposes, obviously, not for the parking in the city on the weekend, although we would all like reimbursements for that. I know that because it's expensive. But again, the amounts refer to appendix. Actually, I think I said refer to the appendix 3, but I think that's an error because there's no amount. So it's about whatever's reasonably incurred. The cost of parking will be subject to the evidence that's actually given. So clause 43 is overtime, and there's a few elements which I've just put on the board, but I'll talk further about. One is, the first one there is about the new definition of overtime, which there are 4 elements to. So workloads, and there are a couple of clauses a little bit later on that talk about workloads. It was quite a bit of the discussion, and I guess this is one of the last kind of items that we were discussing, but there's a definition. Number 1, it's about an employee is required by the employer to do overtime, so it may be clear that you require them to do overtime. That's probably the less disputed type of overtime that you have. And then where it's approved, usually in advance, but it's not always in advance, and it can be verbal or in writing. So there are particular ways that have that. Those 2 are quite standard. The next one is that the employer requires the employee to complete work that cannot reasonably be completed in ordinary time, so long as the employee has discussed or attempted to discuss with the employer that they will be unable to complete their work within their ordinary time. So that is about, people can't just say, well, I'm doing overtime because the work is required, and I guess put in a request later. You need to have that ongoing discussion about workloads to say, well, it's unreasonable, and this is why. For then it to, well, if the employee has then attempted to do that and it hasn't worked, but they're still effectively required to work overtime, then they should get paid for that. But yeah, because VHIA was saying people are doing lots of overtime. Obviously our members saying, well, that's not what our payroll records are saying, and they said, well, it's unpaid overtime, and we said, well, you've got to have a discussion, you've got to do all those type of things. So that's a new one, which will be interesting to kind of see how that actually plays out, because our understanding is there wasn't an issue, but VHIA's was. But obviously there has to be a discussion. It can't just be, here you go, I've done 20 hours of overtime, pay me because you gave me too much work to do. It's not all at the control of the employee. The employer does have that control. And the next one, which is overtime has been performed by the employee due to a demonstrable clinical need that needed to be completed at the time, and authorisation could not reasonably have been obtained in advance. So that's a similar one to the third one, but it's more about, well, if you've got a clinical need and an emergency arises, which I think some examples that they might have given is like, say, if someone has a heart attack in front of you, you're not just going to leave and say, see you later, I'm at the end of my shift, I'm going to clock off. And, you know, there may be times where an employee can't call the employer to say, oh, there's an urgency for this, I need to stay here. That's what that's meant to cover. It's not meant to cover little things where the employee says, well, I think I need to make a decision that this occurs. It has to be a demonstrable clinical need. So those ones will kind of be interesting about how they end up playing out on the ground, because yeah, there was definitely a difference of members' views versus VHIA's views, but they weren't going to agree to settle something without it. They wanted public sector wording, which it's not. We obviously tried to push it further, and it's not public sector wording, but it does have those kind of the 3 and 4 elements or additional ones that people just need to be aware of, and managers possibly as well. So the next one is amended time in lieu of overtime provision. That's really just about making it clear that people can have a combination of payment for overtime or TIL. It doesn't have to be one or the other. You all may agree that they have it paid some or take some till, depending on how your operational arrangements occur. And that it's to be taken unless you agree otherwise within 4 weeks. And then it's also paid on termination, which should be the standard process that people do for paid on termination, but it was something that's in the awards that the Commission was raising, so we made that boot compliant. Then the next one is the minimum payment of 3 hours overtime. That's really about when someone comes in on a day that they're not required to work, so making sure that they get paid a minimum amount. Then the next one is adequate transport free of cost. That's when overtime finishes at a time where reasonable means of transport are not available. So it might be in the middle of the night kind of thing, and there's no trains, and they usually take trains to get home. That's the kind of circumstance that you might arise for that, and then you might, pay for a taxi for them to get home. So clause 38 is public holidays. So there was just a small change that we made there, which really is about substituting religious public holidays. So this is all still subject to your ongoing operational needs, but the employer and employee can agree to change a designated public holiday to a nominated religious public holiday. We've covered a couple circumstances there. Well, what happens to the payment? One is that obviously if when they work on the public holiday, it's paid at ordinary rates, and when they have the religious day off, it's without loss of pay. And the next one, although we didn't think it would ever occur, because why would you agree to substitute if you wanted to then tell them you have to work on the religious day? But we have covered that off, is that if you end up for whatever reason needing to have that employee work on the religious day, then obviously public holiday rates will apply on that religious day. But ideally that shouldn't actually happen, because you've made a mutual agreement to say you're not going to work on that day because it's sacred to them. So clause 49, an annual leave. I just also note there are some things where we did make NES changes, which I haven't really put on the slides today because it's going to be a longer session, but we do have them outlined on our implementation guide. But that's through things like annual leave, personal leave. We have done NES updates, but I haven't put them on the slides, but just be mindful of that. But one where we are addressing it today is a revised process and greater clarity regarding taking annual leave. So number one, it's clear that people can take it before the end of a year. That used to not be the case, but obviously through the NES you can. Any request that's made must not unreasonably be refused. Clarity, it was already in there, but we made it clear through drafting, is that you can't revoke leave that's already been authorised. I don't know if there's any other agreements that have that in it, but this one does. The next one is the response, and timeframes, really responding to a request as soon as possible, but no later than 4 weeks after the application is made. And also within that 4-week time frame, if it's likely that you're going to be saying no to that leave, that you really need to talk to the employee about discussing other options. Now, that should be standard practice in terms of talking to them about different options when you're going to reject something, but it's really more about that 4-week time frame of kind of getting back to them and that kind of consultation periods. Excessive leave accruals is another revised process. So excessive leave accruals are over 8 weeks. That's kind of standard with all the awards. That you have a reasonable opportunity to reduce the leave to 6 weeks within a 3-month time frame. You or the employee can make that request. We basically try and work out, how do we reduce the leave? Can we mutually agree? They may come back to you and say, well, I don't really want to take it now because I've got a planned holiday and I want to take X leave in the planned holiday. So then you look at that, and if it can be accommodated, you do it, but you can refuse it as long as it's reasonable for you to refuse, which is obviously based on operational reasons. And then when a no agreement can be reached, you can direct people to take leave, but there are some restrictions. And some of these restrictions are particular just to health professionals, because they had quite a different restriction in terms of you could only get them to cash out 1 quarter of the particular leave. So we do have a bit of a transitional period for existing employees. So with existing employees, within 18 months of the agreement commencing to operate, you can only do the 1 quarter. So within 18 months, it's only 1 quarter. But for everybody, you can't ask them to take more than 8 weeks annual leave in 1 year of service. So that's for someone that you may have that's had lots of excessive leave. Hopefully people are still managing it before that time period anyway, but just in case you do that, that cap exists for ongoing, not just the transition period, but that first part was a transition period for existing staff, the 1 quarter stays. Then the clause also has information about the direction of leave, which is, I think it's saying you can't make them take it within the next 2 weeks. There's particular times, and you can't make them take it 12 months after. So just putting some rules around that. And also information about disputes regarding excessive leave and what can or can't be disputed. So really some of those changes were made just to ensure that the agreement passed the better off overall test, because that the awards at a particular point actually got changed to clearly identify an excessive leave process. So they're not ideal to what probably I guess employers want, but it's closer and that type of thing. So some of those changes were made for that purpose. So personal leave, just a clearer statement that the transfer, when you're transferring personal carers leave, it does include employers who are listed in the back, which are obviously community health centres, and the people under the Health Services Act. And that's really about the same entitlements. It's making it clearer, but that's what the existing entitlements are under the agreement in terms of portability, which is obviously different to the SACS agreement, which was new in that, and it was only community health centres. You still have to do it for public hospitals in here. The new one is the second dot point, just talking about an employee can use 1 week of personal leave where they may have, say, a disability or are required to go to a registered health practitioner. We say that that really applies where you might have someone that's required to, go to a particular appointment, but they're not really unfit for duty. They could come to duty, but they're required to, get something, something for the chiropractor or something like that. Could be like a dentist appointment or something like that where they're not actually unfit. They're not going to do something where they're going to be unfit for duties, but they're required to attend by the registered health practitioner to get something fixed. Family violence leave. So this is exactly the same as the SACS. VARPA did try and change it, but we said no deal, no dice, because it was important for us to push back on that, which we did a lot of consultation on. So family violence definition in line with the Family Violence Protection Act, 20 days available leave for family violence, but for casuals it's clear it's unpaid. They can access personal leave to provide support to a family member or household member experiencing family violence in particular circumstances. So the circumstances are listed in there. And then still, like the SACS, provides development of internal support measures for employees experiencing or supporting someone with family violence.
Emma, why does it say employees can access personal leave? Aren't they accessing the family violence leave?
So that's for when they're not. Oh, sorry, James, do you want to?
Yeah, so was it a reference to connect?
Yeah, so Anna was just asking that why is it about an employee accessing personal leave to provide to support? So the difference is that with the 20 days family violence leave, it's about that person experiencing the family violence themselves. So a perpetrator may be providing family violence against me, but I may say have a household member in my household in the second spare room, and they've got someone they're experiencing the family violence, but I'm not actually experiencing it. The perpetrator isn't annoying me or impacting me, but they are impacting the other person or a family member that's in another house. So when you're supporting someone else experiencing family violence, it's about being able to access personal leave whereas in this one it's about yourself experiencing. And there may be a fine line between that depending on the particular circumstance.
The draft family violence policy, I can't remember where we got that from. It stipulated that the employee can access the family violence leave of 20 days, not their own personal leave. Not in those words, but that was the impression I got. But I'll double check on our policy.
Yeah, so I think I know you might be talking about maybe a public sector guide that we did. So with community health, we developed a separate and distinct community health family violence clause that it was inserted here. So we haven't done any policy or implementation framework for that, but it may be that we do need that, but we didn't do that specific to community health because I think we did consultation. So, but it is different. So I wouldn't go to you can go to a public sector guide that we issue for assistance, but this is different to the nurses EBA. It's not the same as the nurses EBA. So if your policy says what the nurses EBA is in it, it's not going to match up with this. It's probably I think I would say probably a better entitlement. The nurses would be, yes.
Right.
Yeah. Louise?
Hi, 2 questions. One is the 20 days, is that per annum or rotation? Another question is for an employee to access their personal leave to support someone, what evidence would we ask for?
Yeah. So the question was with respect to family violence leave, are those 20 days capped within a year, a financial year? How much or how often can an employee access that 20-day period or entitlement? And the second question was regarding evidence and what evidence is reasonable, what's required as such.
So I think with the year to year, we haven't actually defined what that is. It is a year, but we don't have clarity on that in if it's a person's year or the calendar year. So I think that's the answer for that one. Yeah. Yeah, it doesn't say service year, but we can take that on board and see with that one. With the evidence, it does actually describe the evidence for, I think, the family violence. I'm just going to check 54.5A, 54.5B. Yeah, okay. I'm just making sure it's connected to this evidence they're supporting as well as the experience. And it is, and so it's if required. So we understand that it's sensitive information, so it's only if you require. Sometimes you may not ask. But it's really an agreed document issued by a medical practitioner, registered health practitioner, police service, court, family violence support service, social support service, financial counsellor or lawyer, or where reasonable, a statutory declaration may be used. So it's going to depend on the circumstance where a stat dec might be provided, because it might be that they need to make safety arrangements for relocation and they need to take a day off to do that. Well, the stat dec may be reasonable unless you say it doesn't. Yeah, I think that's then something where it would be reasonable to say a stat dec and they're saying, well, I need to move for the purposes of family violence to keep myself safe. But I think people wanted a cap on it, but we couldn't quite take it there because it will depend on the circumstance. But yeah, we do specifically address the evidence part of that. And I think that is different, say in the nurses, it's not as strict in the nurses EBA. So clause 59 is parental leave. Adoption leave now includes placement of a child under a permanent care order. So that's a new entitlement. And just for clarity, we did make a reference that obviously there is pre-adoption leave that already exists in the agreement. So it's in a separate clause, but obviously adoption leave, it still includes the permanent care order. So it applies to parental leave and then also the pre-adoption leave that's already in the agreement. We made that clear. Another main amendment is really about the special paid birth leave. You get it under the NES, but we've also made it clear that they get paid special leave equivalent to the paid parental leave when a pregnancy terminates at or after the completion of 20 weeks gestation. I can't say it. I've never worked in a hospital, give me a break. Or the employee gives birth but the child subsequently dies, which hopefully doesn't happen often, but where it is, obviously they get equivalent to the paid mat leave period off. Clause 60, long service leave. So this is about flexibility, because people have asked us lots before about taking long service leave in shorter periods, because the previous agreement used to say it's in 2 or more, and then the next one was only in 1 or something like that. So now we've made it flexible so that they can take long service leave for periods of not less than a week, apart from when, as we talked about earlier, you agree to a transition to retirement arrangement where it can be flexibly used on a daily basis. Then we've also inserted a clause that clarifies that where an employee takes leave at half pay or half the leave at double pay, that continuous service is unaffected. So we got a fair amount of questions on that. So we've just made that there, that it just doesn't change, it's the same. Breastfeeding, that's been changed, which is in line with the nurses' agreement about paid break time for expressing breast milk in the first year after birth, and then also a requirement to have places to allow them to express or feed, and then storage facilities. So that is in line with the public sector nurses. But there was a clause that just wasn't that great in the existing one. Clause 67 is the professional development leave. So time off in lieu at ordinary rates is available for professional development leave for particular periods where they're not required to work. So it's different if you're part-time compared to where you're full-time. So if you're full-time, that's for days that you're not required to work. So say if you're full-time Monday to Friday, and then they do a professional development session on the Saturday, then they get time off in their normal time for that extra Saturday that they went to do their PD. With part-timer, because they have more rostered days off, we've made it slightly more restricted. On a weekend, still exists. After hours, so that's really about, not that during their normal hours, it may be that they work a normal shift or have their hours later, or when it results in someone not having 4 clear days off. So then study leave, that's a lot of this is kind of in the clarity space or that type of thing, is that just making it clear that you can only refuse study leave on where there are reasonable grounds for doing so. Previous wording was slightly inconsistent, but this is kind of similar to other ones, whereas we've left it to the same wording instead of unreasonably refused, but similar. If you can do it, do it. If you can't for particular reasons, then if they're reasonable, you obviously say no. The deletion of the existing subclause of 45.3, and that's really just making it clear that what is taken is what you agree on mutually. So it will depend on the circumstance. There's no set hours that is payable or pro rata. It said it was pro rata for part-time, but it doesn't make sense because there's no amount, and that's what we deleted. So things that you'll look at is, what level of course it is, obviously what your operational requirements are. If it's a Cert 4 versus a degree, there's going to be different levels of what requirement might be for them to study. So you look at all those type of things and how much you need them to see your clients to meet particular needs. But it is what you basically mutually agree on will be the study leave requirement. Then the additional one, similar to all the others, is about where it's not approved, you provide the reasons to the applicant in writing. Conference seminar leave, similar, is that when you're not approving the leave, you provide the reasons for non-approval in writing. So it was inconsistent where you did it in professional development leave but not in others, so we made that consistent. And then the next one is about a new ability to have an employee put an application in to accumulate their conference/seminar leave over 2 years. So VARPA wanted it to automatically accumulate. over 2 years, but we said no, but people can actually make an application for a specific event or purpose. So it may be that, say, in the first year, there's no conferences that work for their PD, and so the next year they want to take all of the PD to go to a conference that's, say, for a longer period. So you would have to look at that application, but it's not an automatic thing. And again, you just don't unreasonably refuse a request. So have a proper look at it to see if it can be accommodated. But yeah, there is a process. It's not just automatic like some of the other clauses. So clause 72, classification and wages. So we made it clear in the agreement so that it all applies from the first full pay period on or after the 12th of July 2018, because again, we're learning from our mistakes in the public sector. Make sure it's clear about when it all applies. So it all applies at the same time, going for ease. And then you've got to refer to Appendix 4 for the revised classification structure. And then we also did fill in at clause 72 the difference of the increments, which I talked about earlier, that we'd explain later. So the grade 1 increments have been updated, which we've got a table on the screen and slide. And that's really about removing the year 1 and year 2 rate, because there was a clause in the previous agreement that had an entry point of year 3 for particular qualifications. Which is really, most people are now either starting with a master's degree or a 4-year therapy-related degree. So that's why we have updated them. There's no point in having year levels that no longer apply in there. So everything obviously gets shuffled up as a result. So the year 3 is now the year 1. Looks like it is, but you were always paying it as a year 1, but you called them a year 3. I did have one phone call where I think there may be some people that fit outside of it. It's that odd exercise physiologist one, where I think they actually did do a 3-year degree and didn't do an intern. So that results in a bit of a high increase, but it shouldn't actually result in, for most people, in any additional increase. It just changes the year.
So should we write to the employees and tell them you used to be grade 1 year 3? We're now grade 1, year 1. Could we say that?
So the question was, should we write to employees of that particular change? So from a grade 1, year 2 to a grade 1, year 3, etc. Example, for example.
Yeah, so in our implementation information, we do say that we give a template letter. We also say, because we have had a general change at basically from the grade 3 below mostly, that people should review their classifications to confirm or change. And we've just said as soon as practicable in our draft implementation, subject to feedback. But yeah, we are recommending that and putting that in our implementation information. So it'll include increment changes, or it may include the progression, because we've got automatic progression, which I'll come to in a couple of slides. So similar process for the grade 2 increments. They've also been updated. So in the last enterprise agreement, we removed the year 1 rate, and that's because the bottom of the grade 2 rate was actually lower than the top of the grade 1 rate. So it makes it kind of superfluous. So that was removed. And again, that means that your year 2 was technically your year 1, and we've just updated that and then amended accordingly. So the next one is something that was agreed to, which is automatic progression from grade 1 year 5 to the grade 2 year 1. So that means that people don't stop at the grade 1, they do progress. Now, I think naturally in community health, that is kind of what has happened in terms of people upgrade to a particular point when they kind of work independently and that type of thing. So there is that automatic progression there. We do have a clause that outlines the translation requirements for existing employees. Where someone's already had 12 months experience at the grade 1 year 7 rate, because we're talking about currently employed, then they will progress to the grade 2 year 1 at the first full pay period on or after the 12th of July 2018. But obviously there will be some people that, as at that date, haven't actually had 12 months of experience at the grade 1 year 7. So where they don't have that experience, they would only obviously increment whenever they reach that 12 months of experience. So we did try to clarify that everybody doesn't just get there and it's not back paid. You have to have the relevant experience to actually get to that level. And then obviously people ongoing, if they're new, then they progress, or people after that point progress. Yeah.
So there's no performance review for this. It's more or less automatic after 12 months, is that what you're saying?
Yeah. So the question was whether or not there is performance review here, or if it's just an automatic progression after a certain time.
So it's automatic, but it doesn't. It's not automatic then from the next point, obviously. So under the next one, if you're going from grade 2 year 1 to grade 2 year 2, there are still clauses in there that talk about experience, and experience sometimes it does talk about utilisation of skills, etc. And some people do performance reviews as a part of that process, yes. So you can still do that when it gets to, okay, they've reached the progression, we progress them, they've reached 12 months for the next increment, you can still do your relevant performance process at that point. But no, once they reach the top of the grade 1 year 7, which in the new agreement is grade 1 year 5, it's automatic. Yeah. But and it also doesn't stop you from doing it from the grade 1 year 3 to the 4. It doesn't stop you from doing it earlier. It just stops you at that point when they've had 12 months at the top, effectively, of grade 1. So then we also did agree to a review for classifications where we didn't agree at the time to change. A lot of that was as a result of the difference between the admin agreement and the allied health professionals agreement. So we did agree that within 6 months of the agreement being approved, that the parties would meet with equal representation to commence a review of the grade 4 rates, the allied health not rates, but just in general, classification review of the grade 4, the allied health managers, the assistant allied health managers, descriptors, and rates of pay. Doesn't say we have to agree, but we have to commence. So that's really just getting a process in order that we're not leaving it to the EBA, which then took time and all that kind of stuff. We'll do it beforehand to see if we can improve that structure, because we have done it at the lower levels. But we've left the grade 4 and above pretty much untouched. So clause 74 is about the backfill of leave. So the previous agreement did have a clause about backfill, but obviously it's been amended. So this is about where an employee is going to take leave of 1 week or more. What do you have to do? You have to consult with the employee and other affected employees about how the workload will be managed in their absence. Usually occurs, so that other affected employees can do their work within their ordinary hours, both when that person is away and after they return, and also the same for the absent employee. So during, when they come back from leave, they can still do their job when they return. So you need to talk to them about managing that workload. And where it looks like through those discussions for the managing of the workload that people will be unable to or unlikely to be able to do their job in their ordinary hours when the other employee is on leave or after they return, that you will make every effort to backfill. So originally I think Barbara wanted it to be automatic backfill, which we're saying, well, no, because some cases you may not require backfill. But it's really related to that workload, because you'll make choices about managing the workload, and you might say, okay, well, we're going to shut that particular service, or you stop doing that particular task, we want you to do these clients. It still allows you to manage that process, but where really there is a requirement that there's additional hours and you still need that done, that's really about then making every effort to backfill, which might include casual or employing someone on like a fixed term basis to cover whatever that relevant period of leave is. So again, that'll probably be another interesting one that'll kind of see what happens, because the whole workload and the difference in communication from our members versus VHIA's members was quite different for workload things, which backfill is a part of. So advertising of vacancies, this is another one that we have connected to workload in terms of timeframes. So for ongoing positions when they're vacant, they'll be advertised within 6 business days, where if you are not going to fill a vacancy, it's going to result in, or reasonably result in, the employees or employee being unable to do their position in their ordinary hours. So there's a shorter time frame of 6 days for advertising. That we've made it clear that it's business days. But in all other circumstances, then it is as soon as practicable, which is in the existing wording, ordinarily within 8 business days. So where there is it's basically, again, where there's a workload impact, you require that work to be done. You manage it in a way where you either do or you don't. And when you don't and you want that work to be done, then it's get onto advertising as soon as you can to ensure that you meet those timelines. And then the employer will appoint someone to any vacant position as soon as practicable. So that just depends on who you get and if they're the right person for the right job, but making sure it's not a huge extended process. And that's just, again, all connected to workloads. So another interesting one. So 77 is the safe staffing and workloads. So we've got a few elements there on the screen. One is about reasonable overtime. So reasonable overtime, it's a different, definition, where it's talking about unavoidable because of work demands and providing reasonable notice, that's usual, or due to an emergency where it's not possible to provide notice. So the next one is about sufficient staffing, so a general principle, and some of these are just general principles that people should and usually do live by, is what we tried to get in there, is that sufficient staffing, that you've got sufficient staffing to enable people to perform their ordinary or their role in their ordinary hours, so they can take their breaks and then they can take leave. But obviously these are still all subject to, you may require someone to work overtime. It's not going to be that you can't work beyond your ordinary hours. Sometimes it will be reasonable. This is more about trying to get rid of unreasonable overtime through putting these principles in here, which is what VHIA says there was happening. Our members don't agree. So then the next one is allocation of work. So allocating it so they can do it within their ordinary hours. And the agreement also has a list of factors that you need to look at, which it includes that the clients, patients and customers are different as such, any consultation, service, treatment provided to them can vary and can take different times depending on those amounts, and also looking at the individual's employees' skills, knowledge and experience. Then the next one is safe rostering practices. This is one that we said wasn't applicable, but it had to go in because we don't think lots of people do lots of shift work. But it's really talking about where the clause requires someone other than a part-timer, because under the agreement, part-timers actually have to have regular specific days, so full-timers don't. That where you don't have a set pattern of work, when you are setting a roster, that you just need to make sure there's the number of changes to the employees' start and finish times are reasonable. So that's really about mostly in the public sector, where you have people starting crazy hours and they do a night shift, morning shift, night shift, morning shift, day shift, all those type of things. It doesn't happen in community health, but VHIA wouldn't leave it alone. And then the agreement also does include a process about working through workload or staffing disputes, which is really when they're raised, you consult, you talk about it, see what you can or can't do, and then it can go to the commission. So another interesting one to see where it actually heads, given the difference of opinion between our members and and VAPA. So clause 78 is the annual close down clause. So we, because in our minds we were trying to keep it close to the SACs, we did amend it. So really talking about the reduced annual close down period between Christmas and New Year's Day. The list of options of what people can discuss instead of taking the annual leave was extended to match the SACs. So that's obviously about till, time off in lieu, unpaid leave, all these other options. Where it is kind of different is that there's a clear statement that the employer will not unreasonably refuse a request by an employee to take accrued days off or time off in lieu or leave without pay during those periods. And then there's also, again, a process for the dispute. So what we wanted to do was, and it's something that in the SACs maybe we'll make clear in the last time, is, well, what's the dispute actually about? How does it go to the Commission? Which is really that you still have to have your discussions first, where you can't actually resolve that. Really, the Commission is meant to be looking at is the employee's refusal to take that leave during that period reasonable, or the employer saying take a leave, is that unreasonable? So it's really about working out for that process, is it reasonable that that person takes that leave, which will depend on the particular circumstance. So it's not like an automatic, and we haven't got there yet, but it's not automatic close down, but it's just making it clear that there is a process for that. But the rest of that really remains unchanged to the existing agreement. So the next one is the Appendix 4, which these are now the classification changes at the end. So general terminology we did change. So UG1 is previously what was referred to, and now it's AHP1, which is Allied Health Professional 1. And then the other definitions used to be called, including UG3, they have now been changed to AHP2. Deputy chiefs have now been changed to Assistant Allied Health Managers, and then Chief to Allied Health Managers. We've also got a definition of what advanced practice is, and that's in line with the DHHS definition. It matches exactly. And then for health information managers, we've also added the flexibility that an employer can recognise other qualifications that are relevant to health information manager work. There's also a statement in there that kind of clearly outlines that you're not obliged to appoint to someone. It's only when you require that particular work to be done that obviously someone gets classified at that job. So with the grade 1, we have an updated standard definition that applies to all the professions. A lot of this you'll kind of hear repeated. It's really about trying to keep things consistent across the grades was where a lot of this this was updated. So we do have a definition of what a grade 1 kind of is, and it's an employee that works on routine tasks within the scope of practice for their profession, consulting with a suitably experienced health professional, which is uncapitalised, which is obviously means you could refer to a nurse, you could refer to anybody else when clinical problems arise or when dealing with clinical matters that they are unfamiliar with. And that also might include that you have secondary consultation as a supervisor or something like that where someone's not actually employed at your place. And then we've got a clear table outlined at the back which outlines the relevant entry points, which is about qualifications, professional associations or registration. So the home visits restriction, so this was again one of the last ones that we kind of got sorted, so it is a bit messy, but there are restrictions when you've got grade 1s doing home visits. First of all, they must be paid no less than the grade 1 year 3 rate, which is the current year 5 rate. So that is a minimum classification. And then the next one is that a preliminary clinical assessment cannot be done by a grade 1 employee with less than 2 years of experience unless the employee has successfully completed an appropriate competency-based orientation. So the agreement does talk about, well, really the purpose of this is to make sure people can safely, independently go out to do a home visit. We say they get that from their skills at uni. VAPA says, well, no, that's not enough experience to go and independently work. So we did try to refute that, but something had to go in. Originally it was, well, grade 1s with less than 2 years experience can't do it, but we were able to get it in, which it's subject to an appropriate competency-based orientation, and there is a definition about that. But really it's about structural learning when you get to a workplace, just to make sure that they're safe to go out there independently. So what you'll need to do is just kind of go through that process to make sure what you do, which we think it does from what we saw from the sample. So we did have a sample of people during the bargaining provide us with some of the mechanisms, which is like a bit of a checklist that says go through the home visits procedures, go through all the home networks are, attend one home visit with someone, so that they can do some supernumerary. It doesn't say what amount of time, but it just says like there has to be some kind of supernumerary time where they're observing someone out, but that can still be one time. It may take someone, one person, one time watching someone to do a home visit. It may take someone 3, as long as they can perform the work safely, which obviously that's what you want and would do. But it does also kind of make it clear that when someone's attending in an observational capacity, a grade 1, so they're not actually doing the work, then this clause doesn't apply. Obviously you can have people observe other people in other mechanisms and they're not required to do the work. Then the grade 1, year 3, minimum rate, etc. doesn't apply. There's also a requirement that they must be able to access adequate clinical support during home visits. So that doesn't mean someone in the room, but it's really just about having someone on call for them to be able to call, which most people have that at not just the grade 1, but other grades as well. Then the last one there is about having a system in place that ensures adequate occupational health and safety, and a preliminary assessment of the client's residence must be done prior to the grade 1's first home visit. So that evolved over time. So it doesn't say that a grade 1 can't do it, but it has to be done before they go out. So most people do that via phone is my understanding. So just making sure that those things are done. It can still be done by a grade 1, but it has to be done before they actually go out. It could be done by a grade 2, could be done by an intake officer at another organisation, because our understanding is some people already had done that when they've been referred, and that's what's the useful stuff about having members in the room at the time, is you need to cover off all those circumstances to make sure it's adaptable to what you already do, because home visits are done clearly in the sector. And this is one that we may, through implementation, have further questions and need to develop guides on that, or resources, depending on how people feel about that when it goes to how do we implement this. And as I outlined earlier, is that there's automatic progression to the grade 2, grade 1 to grade 2 after they've had more than 12 months at the grade 1, year 5, which was the year 7. The grade 2, again, just reminding people, the progression is there from grade 1 to grade 2, and then you would continue to progress through the grade 2 yearly increments subject to the relevant progression at clause 73, which is the kind of question that Anna asked earlier, in terms of obviously the progression clause normally does apply to other yearly increments. We did update the additional duties / responsibilities list, and that's where, in terms of an overall review, needs to kind of occur to make sure we spoke to our reference group, which is about supervision is grade 2 and all that kind of stuff, but just making sure that you're paying kind of in line with what our feedback was to formulate this as a general grade 2 descriptor, which is again just about making sure that there's improved consistency, because if you're doing that at one occupation, it doesn't make sense for you to do it as a separate, as a different profession, which is what they were. It was like, if you're a physio, you do this additional responsibility to get you a grade 2, but as an OT, it doesn't get you an OT. Didn't make sense, so we consolidated a list through the feedback. The grade 3, again, is an updated standard definition. One minor tweak is just about having at least 7 years of experience. There used to be a hard barrier that said if you have at least 7 years of experience in the profession, that's when you get there, whereas we've actually changed it to will normally have that such experience. And really that's about, you may have quick learners that develop very quickly and they develop quickly into a grade 3 role. So just because they don't have 7 years of experience doesn't mean, you know, they can work to a grade capacity and you require them. So some people previously probably said, well, you can't get to the grade 3 level, but I'll pay you the grade 2 because you don't have at least 7 years of experience. Not quite fair. When you have 7 years of experience, you do the same job, then you get paid the grade 3. So that is about if you require someone to do a grade 3 position, regardless of the experience, you pay them at that level. But ideally, normally, that's probably how long it takes, but you may have some quick learners, I guess. And then the definition also recognises areas of expertise, which is like clinical, managerial, education and research. And they're just some duties / responsibilities that people may be doing in those areas of expertise. And grade 3, we have included at advanced practice work at the grade 3 level. So grade 4, just minimum tweaks with that. Standard definition, so that it applies to everybody. Again, the grade 4 wasn't applicable to some professions. It should be applicable to all as long as they're doing that work. And then there's no longer at least 10 years of experience. It's normally 10 years of experience. So similar to that grade 3 change there, still all about the work that's actually being done. And then we've also introduced a Deputy Director of Allied Health, so people may or may not have them. There was a Director of Allied Health, but no one that was an Assistant Director of Allied Health. We have introduced a pay rate, which is halfway between the grade 5 Chief rate, which is now Allied Health Manager rate, and then the Director of Allied Health wage rate. So in terms of more information, I did outline that we have developed draft implementation information. So what we're looking at is a payroll translation guide. So what we were thinking, and we've posted on the app to get feedback and obviously feedback for the reference group, is that currently now you have different pay codes for every single classification. We ideally and hopefully think community health centres want to consolidate them. So it's like if you're a grade 1 employee, then year 1, then that's your pay code. It doesn't matter what profession you're in, that's what you are. So we've done a guide that then would show here's the draft codes, this is where they would translate from all those different professions. So hopefully that should make it easier, but we want feedback on, is that okay, can that be done? And that's really about, does it screw with any of your reporting that you're required to do with the department? Did they say you have to have separate payroll codes to give them information? We have no idea. So that's kind of what the feedback we need is this okay, does that work? So payroll translation guide that then translates old pay codes to new consolidated pay codes. Implementation guide, which is similar to SACS, you tick off the bits and who should do what. A classification guide. So the classification guide includes some of those little changes, and it kind of steps out the implementation saying, well, sometimes it's going to be clear. You're going to know someone needs a reclassification through payroll data. So in that instance, then you do that straight away. But in a second instance, is like if you need to double check the grade 1s aren't doing grade 2 works, well, you do that at a later stage, but you fix the increments kind of initially. So kind of a 2-step process depending on your particular situation. Some you'll know just don't do that work, so it will be easy to just do the back pay according to the increments or something like that. And then, as I discussed earlier, a once-off lump sum payment guide. So they're all available on the app for people to download just as a draft. Again, don't implement anything as a result of it because it's subject to change, but any feedback, any questions, just post on the app or confidentially you can talk to me. But if you have a question, someone else probably has a question about it. So prefer the app if possible. Just in case after today, again, post query on the app or email query@vhia.com.au. Thank you for attending. Perfect. Thanks.